ACF's work with urban American Indian and Alaska Natives. A couple housekeeping items before we get started. If you do not have a mic and would like to participate in the question and answer period, you can call into the toll-free number that's listed on the audio tab of your control panel. We will be holding the question and answer period at the end of the webinar, but you can type questions in as the webinar is occurring under the question tab of the control panel at any time during the webinar. If you are having technical difficulties, please use the chat feature to send a message to the organizers, and we will do our best to help you out with any of those kinds of problems. All right, my name is Rondell Clay. I am the director of the Eastern Region Training and Technical Assistance Center, a resource of the Administration for Native Americans. I would like to introduce to you Ann Bergen, who is a social science research analyst with the Office of Planning, Research, and Evaluation at the Administration for Children and Families, where she manages a portfolio of projects that include early childhood and special populations. Specifically, Ms. Bergen is the project officer for the American Indian Alaska Native Head Start Research Center. She also serves on the ACF Intertribal Work Group, the Tribal Home Visiting Management Team, and is OPR's liaison with the Administration for Native Americans. Prior to coming to OPRE, she was a Presidential Management Fellow at the Justice Department, where she managed gender-specific programming related to female delinquency, violence, and gangs, as well as the national evaluation of the Enforcing Underage Drinking Law program. Ann?
Hi. Well, thank you, Rondell. Thank you, everyone, for participating in this webinar. As Rondell said, my name is Ann Bergen, and I'm a social science research analyst here in the Administration for Children and Families in the Office of Planning, Research, and Evaluation, or as we like to call ourselves, OPRE. For those of you who are not familiar with our office, we basically support the various program offices within ACF, including the Administration for Native Americans, in regard to research and evaluation projects and surveys, as well as performance management reporting. So that is the office that I'm in. One of the other projects that I work on is the Urban Indian Study, which you're going to hear a little more about. I, again, want to thank all of you for participating. And just to very quickly, I'm going to kind of set the context for the study, which I think in many ways isn't going to come to a big surprise to all of you. And what I mean is ACF obviously has a number of different programs that support American Indians and Alaska Natives throughout the U.S. And, you know, they include TANF and child care and Head Start and all of the programs that ANA supports. Many of our projects have requirements where the eligibility for application has to be a federally recognized tribe. And often that's the case because of the way that the law or the legislation was written for the particular program. One example of that is Head Start. That said, as many of you know, the majority of American Indians and Alaska Natives, if you look at the census, either live in urban areas or kind of go from the res to an urban setting more than they are, you know, permanently placed within a federally recognized tribe or a tribal reservation or community. And so with that said, and given the kinds of services, social services that we provide, we really felt very strongly that we weren't understanding the needs with the urban Indian population as it relates to the services that we provide. And so the Administration for Native Americans and Commissioner Sparks approached us in OPRE and said, you know, I think we need to find out more about what's going on here, the services that are being offered by these organizations, these urban and Indian organizations, their successes, their challenges. So really in the future we can help better inform ourselves and develop resources and approaches to better supporting and engaging with these types of organizations. So with a lot of our tribal studies here in OPRE, one of the first things we did was put together a technical work group of experts, many of them Native themselves, and executive directors of some of the urban Indian organizations that we ended up interviewing, to kind of consult with them to get a sense and a pulse of what was going on out there, and find out from them what the best approach would be in conducting this study. We felt like this study should be kind of the first steps, if you will, and to really kind of set the stage and, as I said, develop a better understanding to help us inform policies for the future. And so we worked with a technical work group, and they submitted to us their recommendations on how to design the study. We had limited resources, and so while we certainly wanted to call every organization and speak to any individual we possibly could, we had to kind of weigh the pros and cons of what we had based on the kind of resources that we provided. So Cynthia will talk a little bit more about the study and what it ended up looking like, and some preliminary findings and the next steps. So with that, I will introduce Cynthia Robbins. She is the PI at WestStat. Her and her team have done a lot of work to develop the interview guides that ended up being part of the study, and has been involved in talking to many of these organizations throughout the country, and has done a terrific job, and we are very, very excited about the study as it winds down, and certainly the findings that we'll provide. Lastly, I want to reassure all of you that when the findings of this study are done and can be reported, we will make every effort to share those findings with the entire community in as many different ways as would be as is possible, so that anyone interested and your colleagues or just anyone out there, you know, will be able to access this information, because we know it's very, very important to not only us but to all of you. So with that, I will hand it over to Cynthia. Thanks, Cynthia.
Great, thank you, Anne. And thank you guys for having me and allowing us to present these initial findings from our study. Anne has given a really nice background on what the study, what motivated the study, and in general what it's about. I just want to make sure everybody's kind of clear on our study questions and our methodologies. So let me just give you a little more background on what we've been doing and why. So a primary question, as Anne said, you know, we're looking at the needs of the populations that are living in urban areas. A lot of work has been done on folks living on the reservations, but the urban population has not received as much attention. And so one of the basic questions is, what are the social service needs for the population that are living in the cities? There's also sort of a two-part service network for the American Indian population. We have these urban Indian organizations. You'll see the acronym UIC, actually, Urban Indian Centers, that have been in place for, in some cases, 50, 60 years in these urban areas, explicitly to serve this population. And so one of our questions is, what do they do? What kind of services are offered? How do they meet the needs of the American Indians and Alaska Natives that are living in these urban areas? The other side of the equation is the ACF-funded services and supports, again, which we don't know much about in terms of engagement with the population. And so basic question is, to what extent are these families and individuals actually accessing the programs and services that ACF offers? That's still an unknown. If we were to determine that the population is not engaged, what are some of the barriers? And then lastly, what are the best practices? What are some, or in this case, promising practices that centers and communities are engaging in to overcome some of the barriers and make sure that individuals and families are getting the services and supports that they need? So we had several methodologies that we used to develop the study. First was a literature review, trying to find what was out there in the published and gray literature, if you will, about the urban population. As I mentioned, we had a technical working group that we consulted with a couple of times to try to make sure we were on track with the study and hitting the most pressing needs. And then, as you can see there, we conducted telephone interviews with directors of 35 urban, or up to 35 urban centers throughout the U.S. And in Alaska. And then a similar set of interviews with agencies and administrators of the ACF-funded services and support, so local government agencies. And this was to get both perspectives on services to the population. So we'd hear from the urban centers, we'd hear from the government agencies, and try to see, you know, what actually is going on in terms of meeting the needs of this population. The literature review was completed in January of 2012. At the time, and things may have changed a little bit in the past year, but that still remains to be seen, but the information on the urban population was very limited. There wasn't much out there. What we did learn is that, you know, through the Indian Relocation Act, as well as post-World War II, a lot of Native Americans moved to urban areas or were moved to urban areas ostensibly to obtain better employment and educational opportunities. In many cases, people did a lot better in the cities than they were doing on the reservations. So I think that's important to note. It's also important to note that that success was relative, so that when we looked at the literature, you can see the figures or the statements there that relative to the general population, the American Indian Alaska Native folks who had moved to urban areas were not doing so well. Higher rates of poverty, unemployment, homelessness, lower levels of educational achievement, poorer health outcomes, so higher rates of sickness and death among the population than among the non-urban population. And we couldn't find any information on the interface with ACF services. So really not much out there, which put us in the position of actually conducting a very formative research study, which was actually quite exciting. So as Ann mentioned, we worked with a technical working group outside of the project staff, so folks from ACF, ANA, individuals with my company, Westat, which is based in Rockville, Maryland. We had 12 individuals who worked in urban centers or were directors of urban Indian centers. So we brought the expertise to bear on the study design. It was a 2-day meeting, and they helped us refine the study questions to the extent that what they helped us do was hone in on what can we realistically accomplish with a formative study. Well, you know, we had originally had some questions about educational data and some data sets and things like that, and we said, you know, this is the first study of its kind that we can find. Focus on the interviews and seeing what's happening out there. So we ended up moving more towards strictly qualitative approaches. They also reviewed our interview guides, both for the urban Indian centers and with the local government agencies. And one of the things that they suggested changing was the original protocols were more oriented towards what are the problems that the population faces. And they said, you know, we all have a sense maybe of what the problems are, but what are the strengths? You know, what does the population bring to bear that could be leveraged to improve access, to improve service delivery. And so that was a really critical addition to the protocols that we made, and we have some results on that. And then lastly, they helped us refine the study design. We had originally talked about conducting site visits to 4 locations, and their question was, why those 4? And our best answer was we wanted geographic representation, and they said, well, how do you know? How do you know you're representative? We don't even know what's out there. So they said, you know, move away from the site visits. That's somewhere down the pike. Go back to just finding out what's going on the ground, and spread, you know, cast the net more broadly. And so we did. We actually created a list of all the urban centers that we could find. I think the list ended up being, had about 60 to 65 organizations on the list. A lot of them turned out to be health-only organizations, and we really wanted to focus on social services, which is what ACF provides. And so we honed that initial list down to about 37 organizations, sent out letters to the directors of all of these organizations, inviting them to participate in the study and letting them know somebody from WestStat would be calling them. And like any study, you know, ultimately we ended up with fewer than we sent letters out to. A couple centers turned out to be health-only organizations, and they let us know that. A couple of centers didn't respond to our requests for interviews, but ultimately we were able to conduct interviews with 27 organizations around the country and Alaska. We're still in the process of contacting the local government agencies and setting up interviews with them. We've completed 6 to date and are going to continue working on that to hear more from those individuals and get that side of the story. The interview topics for both protocols were as listed here. Who are you serving? How do you know? You know, what data do you have on them? What are the needs? What services do you offer within your organization, and which ones do you refer out? What are the barriers? American Indians and Alaska Natives in the cities, what barriers do they face in getting the services they need? Again, what are the strengths of the population, and what are the promising practices? Are you doing something in your organization or in your community that's working really well? Or is there something that you would like to try that you think has promise? And so we wanted to learn that as well. I just want to emphasize that our data analysis at this point is preliminary. We're still trying to schedule the interviews with the government folks. We have just begun reviewing the transcripts from all of the interviews to date and have developed an initial coding scheme that has started to identify some of the themes that are coming up from the urban centers. We will be diving in full starting next week. But at this point, because we have more center interviews than the government agencies, the themes that I describe, you know, in the next 20, 25 minutes are those that are drawn just from the Urban Indian Center interviews and not the local government agencies, since that's still in process. So let's start with who are you serving and how do you know? So what are the characteristics of the population that the urban centers are serving? One of the things that we learned is that they are serving both federally enrolled tribal members, individuals who are enrolled in state-recognized tribes, and almost to a center, anyone who self-identifies as American Indian or Alaska Native. So they were going both with tribal enrollment cards and with self-identification. The consistent response we've heard from people is we will serve anyone who comes to us and who has a need. The caveat to that is that the funding mechanisms that provide or support some of these services may be restricted to individuals who are tribally enrolled. So as Ann mentioned, you know, Head Start is for federally recognized tribal members. So you might have individuals who come in who are self-identified as American Indian, but without an enrollment card, CIB card, they wouldn't qualify for services, so, or at least certain services. So anybody's welcome. Services depend upon verification, if you will. I believe with possibly 1 or 2 exceptions, every center we talked to has a database, and they were able to track who they're serving, what their tribal affiliation is. A lot of these databases were developed in response to federal grants and requirements of those grants. So the data are actually very good. We heard from various centers that they serve anywhere from a couple of dozen different tribes to upwards of a couple of hundred. It kind of depends upon the size of the city and, you know, how large the population is that's coming through. But the numbers were quite impressive, actually. And so they said anybody that, you know, wants to come to us for services can. As I note here, many of the centers, particularly the ones that were established in the last, 50, 60 years ago, were really in response to tribal members who had been relocated to the urban areas from the reservations as a result of the Indian Relocation Act. And the goal was to make sure their social service needs were being met, as well as their social needs, if you will. And so a lot of the centers were oriented towards social activities, cultural activities, and just a place to gather, and generally for a local population. What we're hearing now is that they are serving tribal members, and I put here in quotes, from all over. We had reports of folks in Tennessee serving Lakota and Alaska Natives as their primary service populations. We have Lumbee in the upper Midwest being a large population that's being served. And what the word we heard consistently was this is a transient population. And part of what was meant by transient was folks are moving between different areas, different urban areas, so they're going from one city to another. And there's also a lot of back and forth between the city and the reservation. One question that I'll put out to the group, and we can maybe talk about this during the open discussion period, is why the transience between the cities. The city reservation movement I get that. The movement between cities is a little more puzzling to us, so if folks have thoughts on that. Again, this was a consistent comment, and the language was consistent among interviewees. Folks from all over, and hundreds of different tribes. The identified needs, I've kind of broken down into 3 categories on the basis of our review of the transcripts. The first is needs related to being poor. So issues around self-sufficiency. Basic needs: food, housing, transportation, employment, cash assistance. If you are poor, what do you need to become more self-sufficient? And for the low-income population, obviously, this was a critical need. Again, not all American Indians and Alaska Natives that went to the urban areas are low-income. So, we want to kind of keep those separate. But for the low-income, this is they obviously have needs associated with poverty. For all of the populations, despite their income or regardless of their income, these other 2 areas were discussed consistently. So one is historical trauma, and just some of the issues that are the result of genocide, historical trauma events that happened not so long ago for a lot of people. So the substance abuse, the behavioral health issues that people talked about, as well as the lower attainment of education, were described by interviewees as a result of historical trauma, and also often a sense of hopelessness that was maybe not able to be identified. The source was not able to be identified, but people had a sense of hopelessness, and that was linked to historical trauma. The third category is the cultural identity piece, and this was, again, regardless of income level, that a sense that the Indian population living in the cities had lost their connection to their heritage, lost connection to their traditions, and that this lack of connectedness was a problem for many people. And so it was a need that a lot of the centers made a priority in terms of what they were trying to address. So one of our questions was, as a center, what kind of services are you providing to the population? What are you able to provide to meet those three categories of needs? And so lots of supports and services around poverty and trying to help people become more self-sufficient. So we heard about, cash assistance. Small amounts might be enough to help someone pay their groceries for the week, or pay a bill. Different attempts to find housing opportunities for people. Transportation came up as a critical issue across the board, and we heard creative responses to how to address that. In one instance, an individual said, we don't have the resources within our center to establish our own transportation network. So let's leverage what's already out there. And what they ended up doing was establishing a contract with a local cab company to make sure that people who needed transportation and medical appointments could get that. And they actually had, with the cab company, they had the cab company keeping track of tribal enrollment. I can't remember who the payer was for this, but the cab company could actually say how many people they were serving, from which tribe, how many rides they had given, that sort of thing. They'd also, in this particular case, the hospital was a fair distance from the city. It was out in the Midwest, and they set up a van so they could get folks to the hospital for trips, either for their own services or to visit family members who might be hospitalized. So they were doing their best to leverage existing services and not duplicate what was already out there. An additional example was some folks had established food pantries in their organizations, but they also were offering a hot meal at least once a week to the senior population. Not so much, well, partially for nutritional support, but also for social support, so that folks could come in and have a meal with other members of the population and get that sense of connection. A second type of service that is unique, I think, to the urban centers are trauma-informed behavioral health services. So recognizing that sense of hopelessness, that the substance abuse that someone might present with might be the result of historical trauma, and actually being able to say that to people and saying we recognize that there's some events that happen maybe for your parents or your grandparents that have an effect on you. And so kind of naming it, if you will, and then using culturally recognized ways to treat the behavioral health issues that were the result of that. So as I put here, a lot of folks are using sweats to help cleanse folks who were dealing with substance abuse issues. So the trauma-informed piece is critical. In fact, one quote that I had from one interviewee was that, often there's a sense of hopelessness within the family, that mom is angry, the kid is angry, and nobody in the family really knows why. And so being able to, as I say, name it can help to address it. The last piece, which probably isn't a surprise, is working on the cultural identity and making sure that individuals could begin to feel connected to their heritage, either as tribal-specific heritage or what some folks refer to as a pan-Indian identity. And so most centers have classes where they teach language skills or teach kids some of the traditions. So very concerted efforts to provide cultural opportunities for folks, ways for folks to connect to their heritage, but also creating a safe space for people, a place where they could feel comfortable self-identifying as American Indian or Alaska Native, and not feel, as one person said, or many people said, not feel ashamed. And so the centers themselves offered that safe location. When we asked, who do you refer, what agencies will you refer your clients to, this was a consistent response. we will refer to any agency that has a service that someone needs. And I think this is one of our critical findings at this point is nobody, not one interviewee said, we won't refer to the local TANF office, we won't refer to Head Start. They said if we have someone that comes in need and we know there's a provider out there that can meet that need, we will make the referral. So that certainly answers one of our questions, which is, are the referrals being made? Are urban members being made aware of what services are out there? Yes. To a center, yes. So I think it's important to recognize that the services for self-sufficiency that ACF offers are on the radar screen, if you will. Two services that are not are trauma-informed services and cultural services. Those really aren't the province of government agencies, so these are unique services being provided by the urban centers. We did ask about barriers to services, and the barriers came up in a couple of different ways, supply side and demand side. That's the limit of my economics knowledge. But from the supply side, that we heard about challenges from the centers themselves. There are some very large centers around the country, very fairly well funded, large budgets, doing lots of activities, but there are also lots that are really running on a shoestring budget, and often with just volunteer supports. And so for many of them, they are operating with very limited funds, and several reasons for this were mentioned. One I have up there is the federal dollars to the American Indian and Alaska Native populations tend to be place-based, if you will. Monies are given to the tribes, but the tribes are seen as coterminous with the reservations. And so that means that the centers aren't getting the monies, they're going to the reservation. It also means that when a tribal member leaves the reservation and comes to an urban area, the dollars don't follow that individual. So someone may come into the city, need some assistance, and it's going to turn to the center for help. The center's working on a very limited operating budget, trying to meet the needs of lots of folks coming in. We did have one center say that when a tribal member comes in, they will actually contact the tribe and say, we have someone here from your community, can you help? And trying to bridge the gap that way. So that was one challenge. An additional challenge for operating funds was with the general government dollars. One important challenge to that is they said we're not really very competitive with other low-income populations because the American Indian population is dispersed throughout the city. We don't have a single location where you can find all of us, and so it's sometimes hard for people to get to the center for us to provide those services. So we don't have a critical mass, if you will, and it can be very hard to be competitive when applying for grants. The second thing that came up, and this actually came up in the technical working group meeting as well as an important point, is that if you accept general government funds as an agency, those dollars are meant to serve everybody. This was a point of contention for some individuals who said, you know, this is American Indian space, this is a safe space for us. If we have to open up services to everybody, Indian, non-Indian, we're not going to do it. We don't want the general dollars. We want to keep this safe for us. We had other centers say, you know, there's money there. And there was some resentment when we first did it, they said. But ultimately, that money meant that we could provide more and better services to the Native population living in the city. And so they said, you know, within a year or two, people kind of got over that and said, hey, actually, we're providing more services to the population. We're better able to meet their needs. So that's still an issue that's in flux, I think, but there are some challenges around accepting general dollars, and those are being worked out center by center. additional barrier to services from the government agency side is, one is that it's, I think the big one is that it's an invisible population. In Tennessee, for example, there are no federally recognized tribes, and our understanding was that there is just now one state-recognized tribe in one section of the state. It is completely off the radar map for folks in Tennessee that there are Native Americans living in the state and living in the urban areas. And so that may be an extreme case, but in many instances, it's a population that folks simply aren't aware of, and with that lack of awareness comes a lack of understanding of the specific needs of the population. And so, again, one of the things we're trying to understand when we do the interviews with the government agencies is, to what extent are you serving this population? Do you know? And what are the needs of the population? An additional thing that came up from our interviews with the centers was that if government agency workers recognize they're serving American Indians, there's a lot of misconceptions, misperceptions that come up during the service encounter related to the person's Indian identity. And some of the things that they said they've often heard from their clients are workers saying, well, you get casino money. Why are you coming to us for support? These are general dollars. Or, you can get that service on the reservation. What are you doing here? Why don't you go back to the reservation and get what you need there? A third issue that came up was a perception that all Indians are drunks, and that's the only service they need is service for alcoholism. And so a real ignorance and just general lack of awareness of the population and what the needs are in the urban areas. From the demand side, from the target, the folks who are coming to the centers for services, there were several challenges that were mentioned by folks. One, the first is really a challenge around assimilating into the urban environment, that there are services available on the reservation, Indian Health Services, for example, other services, that are just available. Once you get into an urban area, you got to find them. And it's a large, New York City is a big city. You got to figure out where the services are available and how to navigate the system. And they said that is a huge problem for many individuals. It's a big system. It's a big bureaucracy. Figuring out how to work through it to get the services that you need can be a real problem. Lots of folks missing necessary paperwork, Social Security cards, birth certificates, photo IDs. Fear and distrust of government agencies came up a lot. Some people said it's sort of overblown. Some people said it's not at all. That because of historical experiences, there's a real fear, particularly around loss of children, that once you're under observation, if you will, from a government agency, the potential for losing your child for a misstep is huge, and a lot of folks would not request assistance because of that. Discrimination, and this came up as both real and perceived discrimination. Some people said, we have clients come back to us and say, the things that I just mentioned about, you get your casino money, I'm not going to serve you here, that sort of thing. Someone else said, particularly around low-income populations and the services needed for people who are poor, the interviewee said, agencies treat poor people poorly. And he said it's not an American Indian thing, it's what we do with poverty in this country, and it can easily be misperceived as an American Indian thing, but he says they don't treat anybody well. Maybe an overstatement, but there was a general perception that caseloads are high, people are swamped, and they don't have the time to be as compassionate as one might want. So that is an issue. Again, discrimination, real and perceived. And then finally, a sense that the American Indian population as a whole is not assertive enough in asking to get their needs met. And so we had center directors say, we'll send somebody to an agency to get the service. They'll be told no, because that's sometimes how bureaucracies work. If you don't have, all the I's dotted and the T's crossed, they kick you out. And instead of staying and trying to get the situation resolved, the person will just leave. And they said that lack of assertiveness it works in their disfavor, if you will. And so that was an identified barrier for many. That being said, there are population strengths that were mentioned by several interviewees that we want to explore a little more as we go further into the analysis. One that came up consistently was the resilience of the population. Despite historical trauma, despite poverty, despite loss of cultural identity, this population is still here and still trying to make it. And that resilience, they said, is very powerful and can be leveraged to ensure that the population thrives, to ensure that these individuals become self-sufficient and get connected to their communities. The living in two worlds, somebody said a foot in two canoes. The notion of being bicultural is a strength for many. Being able to walk in both worlds, being able to navigate both the traditional system and the urban system. And importantly, because there are many individuals coming into the city for the first time off the reservations, bicultural individuals could be important ambassadors, if you will, and providing guidance for how to assimilate into urban life and how to navigate the system and what you need to do that. So a real asset to the community for those individuals that can navigate both worlds. They also mentioned that a lot of the individuals in the cities come with trade skills. If you don't have the money to pay a mechanic to fix your car, you're going to fix it yourself. If you can't afford a plumber, you're going to figure out how to do your own plumbing. So they said that there's a skill base there that may not be licensed, but it would be an easy parlay into a license and an occupation. So a lot of trade skills that otherwise might go unnoticed. And then lastly, artistic skills that could result in revenues, or additional jobs around graphic arts, things like that, that could help the population thrive. I am looking at my time, and I'm going to give it just one more minute here. So a couple promising practices that I just want to mention. One is that in the urban centers, they are using navigators. And so what they said is we will walk with the person wherever we refer them. We will walk with them as best we can to make sure they get what they need. And so having someone alongside to be an advocate and to be assertive for you on your behalf was perceived as both important and effective in making sure that the individual got the services they needed. Training of government agency workers. Almost every center seemed to have somebody that was engaged in cultural competence training. The challenge with that, they said, is there's a lot of turnover in agency workers, so you have to keep going back. Nevertheless, it's important to make sure people are aware of who they're serving and what the needs are. And lastly, and I think this is probably one of the most interesting that we heard about, was co-location of services. Certainly putting someone who is American Indian or Alaska Native in the government agency to be the ambassador, to make sure that culturally appropriate services are available. But the other side of that was to bring government services into a Native American one-stop shop, if you will. And so if you've got safe space that's Indian space, bring the services into the safe space, and people, they said, are more likely to go and ask for help and to follow through on it. And so that was one of the more interesting, promising practices that we heard from several places, both as a wish list and as something that some centers are already engaging in. So with that, I'm going to stop, see our next steps, and open it up for questions.
Thank you so much, Cindy. Now is the question and answer period. If you have a microphone hooked up to your computer or are on the telephone, you can raise your hand which is on the control panel, or you can type in your question and I'll read it over the air so that Cindy or Ann can address your questions. So I do have a comment to start off with. Cindy, when you were talking about the, you wanted to have a discussion on reasons behind the transientness of the population, Donald Miller said that for him, he relocated to 7 different cities in 30 years, and each time it was work-related.
Okay.
Okay. Now we have a comment from Jamie Bartkus. Congress appropriated $1 million to conduct a national needs assessment for urban Indians in 2011. Much of this information seems duplicative. How did you coordinate with the national needs assessment?
I'm actually going to turn that question over to Ann, because that sounds like a question more at the agency level.
Sure. Hi. I'm not aware of that, and I say that with embarrassment because I should be. I can tell that you often, which isn't a big surprise, is, you know, we have all these different agencies within the federal government. So often, if needs assessments are conducted, they may specifically relate to that agency and what it does. For instance, Cynthia and I have been in touch with folks over at HUD who are conducting a very similar assessment, if you will, of the needs and services that HUD provides in relation to housing. And we have been talking to each other, and we're kind of along the same timeline in terms of where the studies are and when we expect findings. And so we've been talking to one another to make sure that we share information. And so while I'm not specific about the study, we certainly wouldn't want to be redundant in any way, but my thought is, without knowing exactly what it is, that it could be a study that's being conducted that may not necessarily match perfectly up with what we at ACF do.
Thank you, Ann. We have a comment from Robert Hopkins. Have you found some mobility based on domestic violence issues?
That is a fantastic question. We have not found mobility as a result of that, which doesn't mean it's not happening. It's not how it was discussed. We have heard about a lot of centers offering services around domestic violence, and in particular a movement towards providing services to the batterer, which I think is a new movement within the domestic violence service arena, but an acute awareness that it is a challenge and that it's a need that needs to be addressed. And I think it's addressed under the historical trauma sort of rubric, if you will. But it's a really good question about the mobility issue, and I will go back through the transcripts and look more for that, because I'm really not sure.
Going back to Jamie Bartkus, her comment is, given the limited resources we have in urban Indian communities, I recommend you contact the Indian Health Service so that you are not duplicating work that has already been done. There may be ways you can complement the National Needs Assessment. The study covered both health and social services.
That's a fantastic recommendation, and if they have information on the social service component, we would definitely benefit by talking with them. As I think I mentioned, we really aren't looking at the health side, so and with limited resources, we just tried to focus. But if the national assessment has both sets of data, we would be very interested in that. So thank you.
I have several comments from Mary. Mary, I've just unmuted you. Do you want to ask your questions?
Okay, thank you. Can you hear me?
Yes.
Okay. The issue is, I have had about 30 years experience as a Native American person and as a administrator in welfare organizations, rehabilitations, and so forth. We've always managed to partner with the urban Indian centers where they've been available in the area where I was working. And I'm, first of all, very saddened to find that the same issues that existed then still are in, in barrier position today. And I was just wondering, what really innovative things have you thought of yet that would break this barrier and make them a little bit more effective for the people who really need them and will not access them for a variety of reasons?
Boy, that's a big question.
It is. It's a long one.
It is. Of all the things that I've heard, I think partnering with the agencies within Indian space, if you will, and that's a tall order because it requires having sufficient revenues to rent space, to rent a building that has multiple offices in it. But to my mind, and from what folks are telling us, you create a safe space. You've got your navigators right there who can walk you across the hallway if need be. And the fact that you, as an Indian organization, are bringing these folks in suggests that these outsiders, if you will, these government agencies are credible and trustworthy because they're here. To me, that is the most exciting and promising opportunity out there. I don't know how you would generalize it or implement it more broadly, but it has all the hallmarks of exactly what's needed.
Well, one of the things that I did do personally as a director of public welfare in Los Angeles, California, was to set up a complete unit of Indian child and family services, and staff them with BSW trainees and MSW students at the University of California in Los Angeles, and they worked that entire city and with Native Americans and really got them acquainted with the Indian Child Welfare Act and all of the other services that are available without really taking away any of the money from the Indian centers. So it can be done.
Yeah.
That's my bottom line here.
This is Ann. Two thoughts come to mind, and it is such a very complex question to answer, observation.
Yeah.
I think, part of the two things that comes to mind for me is I think that the way that some of the legislation is written, it's almost as if the people writing it haven't looked at the census in the last goodness knows how many years. That said, it's not perfect, and I understand that certainly within Native communities there are a lot of issues around it. But what it does tell us, again, is, and Cynthia pointed out, not every Native American, needs the kind of safety nets and social services that an agency like ACF provides. That said, when over, what is it now, almost 70% of a population is within a certain area, but the way that we're setting up how we facilitate services and working with tribal communities, we are only looking at it from that federally recognized tribe out on the reservation aspect of it. I think that we are woefully missing the mark. That said, tribal sovereignty, sorry, it's hard for me to say, sovereignty, and a tribe being able to provide the service and address the needs of their people is tremendously important. So I think that's why that intention is there. That said, So the other thought I have is, you know, a lot of the tribal organizations that we work for are tribes. There's this, you know, idea of interoperability, the one-stop shop. You know, Cynthia kind of referenced that. And there are programs like the 477 programs that basically realize, you know, we understand that we overburden with organizations that provide services with a lot of paperwork and a lot of redundancy and all that. And so if you, regardless of what that family needs, if you're serving the same folks, whether it's TANF, whether it's child care, whether it's whatever it is, we want to try to eliminate that burden. And so programs like the 477 have helped to kind of streamline these services for organizations that are Native run, so that they can then better serve the people that they're serving in a much more streamlined and efficient way. Cynthia talked about how overwhelming it is for folks to go into an urban area and to figure out where do they go for services, especially the services that they, you know, a tribal organization where they would feel more comfortable is very difficult. You mentioned eligibility. That's also a huge thing. It's very sad to hear how some folks, it's those relationships, right? They don't understand a lot of what they're eligible for, and it really takes you know, dedicated individuals to enlighten folks and reach out to them within a community, which is really tough in an urban setting, to say, you know, you're eligible for this. Let us help you. We can provide child care for your child, so if you want to go out and find a job, we can help you with that. These are, you know, some of the challenges. So thoughts I have around that is just this whole issue of urban versus reservation and eligibility. And the other thing is just helping tribes to provide a myriad of services, better streamline the way that they do things, because as we all know, it's very frustrating to have to jump to a million different places to get the services that you need. So, and you know, a lot of folks don't have a car. They rely on public transportation. These little things, or I don't have a cell phone. I mean, you all know better than I that those little things can really impact an individual or a family. So I hope that somehow answered your question.
It does. Thank you very much. You're doing as best as can be done under the circumstances.
Okay, thanks, Mary. Thank you, Anne. We have a couple other questions before we're almost to the end of our hour, and we have a couple questions left. How can we access the list of advisory members and or the list of agencies interviewed? Very good question. We have a report that was done, and I believe that it's up on our website at OPRE. So if you go to www.acf.hhs.gov, and it's really a powerful report. And if it's not there, then it should be, and I will make sure that it gets up there. But it was a report that basically summarized the consultation that we did with the technical work group and their findings, and so and also it kind of lists the individuals that were involved. So I will check on that, and we could send out, you know, an update, you know, with our friends at ANA to make sure if anyone's interested in that, they can access it.
All right, and our final question, since we have reached the 1 hour mark, is NORC, N-O-R-C, at the University of Chicago, part of the housing study. I understand they are conducting a housing study with tribes, and not all the tribes are on reservations.
may be a question for the group at HUD. Because this is Cindy, I really don't know, but the folks at HUD may have more information on that.
Okey-doke. Thank you, Cynthia. Well, we want to thank everybody for joining us today. It was a very interesting presentation. Thanks to both Anne and to Cindy for the presentation. Our next webinar is next week, ANA webinar, so please join us then. Thank you all for joining us, and have a good afternoon.
Thank you, everyone. Take care.
Thank you.
Bye-bye.
Bye.